If you want to treat your acne with aspirin, then this complete video guidance is perfect for you. In this video I tell you treating acne with aspirin is effective or not. If we talk about the scientific data, unfortunately scientific data is lacking, but many people report aspirin as an effective acne treatment. Aspirin contains acetylsalicylic acid, a similar substance to the common acne-fighting compound salicylic acid. Aspirin is a proven anti-inflammatory that can, in theory, reduce the likelihood of acne breakouts. Some acne sufferers report topical aspirin paste can also reduce the visibility of acne scars. Some people report success using aspirin for acne as a topical remedy to improve their condition. While there is a significant body of anecdotal evidence to support these claims, to date there has been little scientific study conducted to confirm or dispute their validity. So what is aspirin in a simpler term? Aspirin, or acetylsalicylic acid, is commonly used as a pain reliever for minor aches and pains and to reduce fever. It contains acetylsalicylic acid, which is related to the popular anti-acne ingredient, salicylic acid. Does aspirin work to treat acne? Aspirin has the most potential as an anti-inflammatory agent to treat inflammatory acne. This includes cysts and nodules. It's unlikely to work for non-inflammatory acne, like blackheads and whiteheads. There is some evidence indicating that when applied topically, aspirin might reduce the underlying inflammation that is the partial cause of the condition. So how exactly does aspirin work? Acne forms when dead skin cells, oil and debris deeply clog pores, resulting in the proliferation of C. acnes. Aspirin's active ingredient is acetylsalicylic acid, a synthetic derivative of salicylic acid created by a chemical reaction between it and acetic acid. Some people claim positive results from applying crushed aspirin to their acne blemishes, the premise being that the acetylsalicylic acid found in aspirin will function similarly to salicylic acid and reduce pimples. Theoretically, aspirin should help dry out the inflammation and by extension help clear the infection and reduce the blemish. Clinical studies have shown that aspirin applied topically is effective at reducing skin inflammation related to numerous conditions, but it is also needed to know when we take it orally. It works when we apply on skin. It is not confirmed. It concluded that topical aspirin helped reduce some symptoms, but not the accompanying itch. This study didn't look at the role of aspirin on acne lesions, though. If you choose to use it, topical aspirin isn't recommended as a form of acne treatment. However, if you do decide to use it, follow the instructions below. Step 1. Use powdered aspirin or completely crush a few tablets, not soft gels. Step 2. Combine the aspirin powder with 1 tablespoon of warm water to create a paste. Step 3. Wash your face with your normal cleanser. Step 4. Apply the aspirin paste directly to the acne. Step 5. Leave on for 10 to 15 minutes at a time. Step 6. Rinse thoroughly with warm water. Follow up with your usual moisturizer. You can repeat this process as a spot treatment once or twice a day until the acne clears up. It's important to remember that using aspirin too much can dry out your skin. Because overdrying can lead to more breakouts, it's important not to strip away all of your skin's natural oils. Possible side effects. The most common side effects of using topical aspirin are skin dryness and irritation. Peeling and redness may occur as a result. Mixing aspirin with salicylic acid can increase these effects. You may also be more prone to these effects if you apply topical aspirin often. Any acne treatments you put on your face, including aspirin, can increase your skin sensitivity to the sun's ultraviolet (UV) rays. Be sure to wear a broad-spectrum sunscreen that protects against both UVA and UVB rays every single day. As a precaution, avoid using any form of aspirin during pregnancy and breastfeeding, unless your doctor tells you to for certain medical conditions. This can increase the risk of bleeding in your child. Aspirin is a nonsteroidal anti-inflammatory drug, NSAID. As such, don't use aspirin if you're allergic to other NSAIDs, such as ibuprofen and naproxen. There are some better alternatives to treat acne. These alternatives give better results, and there is scientific evidence that proves the effectiveness of these chemicals. First one is salicylic acid. Salicylic acid will provide similar or better results than aspirin for inflammatory acne. It's also been shown to help reduce non-inflammatory acne like blackheads. Second one is benzoyl peroxide. Benzoyl peroxide is an ingredient commonly found in many OTC topical acne treatments. It helps to prevent pimples and treats existing blemishes by killing bacteria underneath the skin while clearing dead skin cells and excess sebum in the pores. Third one is azelaic acid. Azelaic acid is a prescription cream or gel used for mild to moderate acne. It possesses antibacterial, anti-inflammatory and anti-keratinizing properties that work to reduce pimples. Topical retinoids like retinol help treat acne by spurring the turnover of skin cells, accelerating the removal of older skin cells and the growth of newer, acne-free skin cells. Some people, particularly those with allergies, sensitive or dry skin, don't always react well to conventional acne medications and prefer alternative therapies. There are a variety of home remedies, like essential oils or aloe vera, shown to be valid acne treatments in their own right. Tea tree oil is an essential oil with natural antibacterial and anti-inflammatory properties that kills C. acnes, the bacteria responsible for acne. It also has anti-inflammatory properties to effectively address the associated swelling and redness. Many other essential oils also kill bacteria. Among those believed to be the most effective acne fighters are thyme, cinnamon, rose, and rosemary. Aloe vera is another plant with natural antibacterial and anti-inflammatory properties that are understood to reduce the appearance of acne and prevent breakouts, particularly when combined with tretinoin cream. I also give you 2 video links about treating acne at home, which will help you a lot. Or it to your family and friends so that they cure their skin problems. Conclusion. While aspirin for acne has yet to be the subject of much academic study, given the anecdotal evidence and what's known about acetylsalicylic acid, its active ingredient, there is reason to believe aspirin could help with certain cases of inflammatory acne. At the same time, there are conventional OTC acne treatments that have been tested and proven to be effective, so incorporating aspirin to reduce acne blemishes or scarring may not be the most pragmatic approach to treating the condition. People report mixed results when using aspirin for acne. Some swear by its efficacy while others claim it made no difference to their condition at all.